Okay, so we've talked a lot about the role of public health nursing and how it centers around patient education. As we all know, patient education is a huge aspect of nursing in general, but in particular with public health nurses, I think it's vital because of the close contact we come in with the community. We develop relationships, establish rapport, and because of this, I think that the community tends to listen to what we have to say and trust what we have to say. So some of the aspects of patient education are anticipatory guidance, focusing on concerns, sharing data-supported evidence, and clarifying misconceptions. Anticipatory guidance is exactly what you learn in nursing school. It's anticipating whatever education needs the patient might have. So this could be teaching about side effects like a mild fever or soreness of your arm after the injection. And then, focusing on concerns is staying open-minded, non-judgmental, actively listening to your patient's concerns, validating them, but at the same time being able to dissipate any reasons they might not want to vaccinate themselves or their children. And a big part of this is sharing data-supported evidence. So a really great website to point them in the right direction is the CDC. The CDC does a really good job of providing any information about immunizations, what diseases it prevents, its effectiveness, and also any adverse reactions that have been reported with that immunization in general. So a really good resource to give to your patients. As for clarifying misconceptions, this is hard to do with social media and the internet. It's kind of an uphill battle these days. But I think one of the misconceptions when it comes to the meningococcal B vaccine is that when you're trying to teach a 16-year-old or a 22-year-old or however old they are, and you tell them, oh, there was an outbreak at Princeton or there was an outbreak at UCSB, and they're like, oh man, there was an outbreak. How many people got the disease? And you're like, oh, 9 people at Princeton and 4 people at UCSB. And they kind of look at you and they're like, yeah, that doesn't seem like that many. Until you tell them that, okay, well, the FDA approved this vaccination and we started giving the vaccination, and then maybe because of that in patient education, we were able to stop it at 9 cases and 4 cases, and we were able to prevent the spread of the disease. Also, on top of that, having to educate the patient and tell them, okay, well, maybe only 9 people got it at Princeton, but one of those kids died. Maybe only 4 people got it at UCSB, but one of those kids was a lacrosse player who lost his lower limbs to the disease. So I think sometimes driving the severity of the disease home and the potential outcomes of this disease can go a long way in educating the patient and motivating them to get the vaccination. So as public health nurses, that's our job, is educating the public, educating our patients, educating the community. And as long as we're out there doing that, then we have done a large part of our role in being a public health nurse.